The following paid program is sponsored by Innova. Join the future of health.
Well, good evening to you. I'm Derek McGinty. Living a healthy life is a personal journey. You might have a family member encouraging you to eat healthy or a friend with whom you play golf, but at the end of the day, your health depends on you. And if you do need medical attention, the treatment you receive needs to be personalized just for you. Tonight, we will hear stories of how Innova is delivering personalized health treatment plans that are not only improving the quality of life for their patients, they're saving lives.
I think the two major ways in which care will be enhanced. One is we will bring together what we refer to as interdisciplinary care. The other thing we will be able to do is integrate the study of the detail of a patient's tumor and in fact their genome in order to help us predict and define the best treatment for a patient at the right time.
All of a sudden it was like the Liberty Bell being struck, you know, all of a sudden there's all this hope.
My husband and I say this all the time, that we forget that I, have cancer.
Having the treatment that's tailored to my genetic makeup, what could possibly be better than that?
And to have this new opportunity become available to her because of these new technologies, it just gave us new hope.
Well, good evening and welcome to Genomics, the power to predict. The people you just heard from are experiencing personalized healthcare firsthand. And joining me now, the experts that are making that possible. Dr. John Deacon, Dr. Timothy Cannon, and genetic counselor Tiffany DeMarco. Welcome to all three of you. Good to have you here with us.
Thank you.
Dr. Deacon, talk about why this is such a game changer.
When we broke the human genetic code about a decade ago, it ushered in a new era for us to understand disease at the genetic level, how to understand how to give therapies to patients, and hopefully someday to predict and prevent disease in the first place. So this new era has now been opened and we're trying to apply it at Innova to improve our patients' care.
It sounds like this is the end of one-size-fits-all medicine.
Exactly. What this means now is that physicians and care providers need to understand the genomics of their patients as well as the disease and the treatments to make sure each treatment, each drug is right for that patient.
Fascinating stuff. We're going to hear a lot more about it before our broadcast is over. And it really is a team effort at Innova, and one way that team comes together for its cancer patients is with a molecular tumor board. Think of it as a team of doctors, researchers, and genetic counselors appointed just for you and your specific cancer. Andrea Rohn met two patients who've experienced this innovative approach to cancer treatment.
Lee Felice and his wife Cynthia thought his stage 4 cancer diagnosis meant they didn't have much time left together.
It is a terminal illness, okay? And without Innova, without the tumor board, without Dr. Cannon, without Keytruda, I wouldn't be here. I wouldn't be here right now.
We thought we weren't going to have much time at all. Right. I mean, on a personal note, I mean, we've been married 45 years, and I thought our time was up.
Lee has a rare gene mutation in his tumor that would not have been found without the tumor board at Innova. Dr. Milburn Jessup is the pioneer of Innova's molecular tumor board.
Molecular tumor boards in general are important now so that we can get information to match the changes within individual tumors to the best therapy at the best time for those patients.
It's a relatively small number of patients who can get a true targeted therapy, about 25%. When Lee and Cynthia found out he qualified, they realized they still had hope.
And it was like the Liberty Bell being struck, all of a sudden there's all this hope because of what the tumor board was able to look at my case.
Innova's molecular tumor board starts with testing the genetic makeup of a patient's tumor. Then a group of doctors, clinicians, and genetic counselors all review the case as a team, and the patient is invited to be part of that meeting. Trista Miller was diagnosed with metastatic pancreatic cancer.
On traditional chemotherapy, it wiped me out. It was really tough. Makes you feel ill, but also just no energy. So I couldn't even walk. I couldn't even walk up the street.
She was too sick to attend the tumor board meeting discussing her case, but Trista's husband Glenn and two other relatives were there.
Because when you get the diagnosis of what she received, it deflated everything in our expectations of life. And to have this new opportunity become available to her because of these new technologies, it just gave us new hope.
A rare gene fusion was discovered in her cancer, and because of the tumor board's analysis on Trista's new personalized treatment plan, she's taking a pill with minimal side effects.
Because it's still there, I'm doing remarkably well, and things have really shrunk, and I'm progressing beautifully. But it's still there. But really, I don't even think about it anymore. Where it used to, it controlled your daily life.
Since I've been taking the immune therapy, my life has returned to normal as far as the quality of life I used to have. I ride my bike and an hour and a half a day, and I go to the gym for an hour and a half a day.
It's a game changer, and especially with my own family, seeing drugs being used in new ways by caring physicians in different parts of the country who are able to tailor treatment to really improve each individual person's condition for as long as possible. It's huge.
I'm not suffering from cancer, I'm just living with cancer.
And if I could just add, we just got back from our almost annual vacation with Cab in Colorado, and we were able to ride bikes every day. We were able to hike, some pretty challenging hikes. And he was able to play golf with his sons, and just like we've always done. So we were just so blessed to have that time together again.
And to see those personal stories, it really brings it home. We see Lee riding his bike. Dr. Cannon, talk about how big a deal that is, because his cancer was particularly challenging.
Yes, he had a really challenging cancer and wasn't doing as well on conventional treatments. And so when the molecular tumor board identified this treatment for one of his genes that was mutated in the tumor, we were all very excited, and he's done very well since we've started it. He's in such good shape that he's riding bikes. He even wants to play me one-on-one in basketball. He's like 6'8", 3 inches taller than me, and he is doing really well. In the case of Trista, that was also really exciting because she had cancer associated with a very poor prognosis and had a very rare gene fusion. And some of the great, really good scientific minds in our tumor board, like Dr. Maitland and Dr. Jessup, they really helped us identify a pill that would help her, and it really has helped her a lot. She's improved a great deal, and whereas before she was on chemotherapy that was making her sick, now she's on a simple pill.
The question, of course, is why doesn't this work for everybody? 25% seems like a low number.
It is a low number, but I think it's going to improve over time. The problem is that even when we identify mutations in the tumor, we often don't have treatments to combat that mutation. Usually we can find something, but there just isn't the medicine yet to treat it. But I predict that in the coming years there will be more and more, and that number will continue to rise up.
Tiffany DeMarco, we saw the tumor board at work, but I was struck by the fact that the patient is in the room as well. That sounds like something that's very important to keeping people involved in their own treatment.
Yes, it's very important that the patients are there and that they're able to see and be a part potentially of the discussion about the particular changes in their tumor. So for both of these patients, they were also referred to see a genetic counselor because it's very important that they understand that the changes that are identified in their tumor may indeed have implications for inherited cancer risk.
So what is the number one question you get from people when you're sitting down with them and they're dealing with these incredibly life-altering issues?
So patients really want to know, what do these genetic changes in my tumor, what do they mean for me, and potentially what are the implications of additional inherited genetic testing for both me and for my family members.
And the big deal here, of course, is hope, right? Diseases that a lot of people thought couldn't ever be cured. We heard the phrase living with cancer, which is better than dying of it. Thank you, guys. We'll be talking more. Well, coming up after a quick break, we're going to meet a NASA scientist who is enjoying life after a heart attack and surgery, all thanks to genomics and its power to predict.
Genomics, the power to predict, is sponsored by Innova. Join the future of health.
Let's just say it. There's no such thing as cancer. There's only your cancer and the precision treatment we derive from your genes.
Let's embrace the wisdom of your cancer's DNA when we learn a throat tumor is best treated by a breast cancer drug.
Let's give you a seat at the table of experts in your cancer And as a team,
develop a treatment plan with and just for you.
Innova. Join the future of health.
Well, welcome back. Well, it is not exactly a crystal ball, but for some Innova patients, pharmacogenomics is the next best thing. That's the study of how your genes affect how you'll react to certain drugs. NASA scientist Craig Dobson is living proof of how powerful that knowledge can be. Andrea Rohn has his story.
Maintaining your own individual health is a personal journey. At Innova, the concept of personalized health means creating innovative therapies that enable their patients to live longer, healthier lives. It's a custom approach that puts the patient first by using genomics to create personalized treatment and targeted therapy plans for each individual.
So I'm in bonus time. Bonus time thanks to the advancement in medical science technology. This is a big deal.
NASA scientist Craig Dobson is outliving both his father and his grandfather. Both died from heart complications, so Craig's genetic makeup places him at higher risk of cardiovascular problems as well. After a heart attack just last year, doctors placed stents in the arteries of his heart to keep his blood flowing.
Before they emplaced that second stent, some of the staff came in and asked me if I would like to volunteer to take a test, look at my genetic makeup to see if I could be treated with Plavix.
Plavix is one of the most widely used heart medications, but is such a popular drug right for everyone?
He was in critical condition.
Dr. Tarani is an interventional cardiologist at Innova Heart and Vascular Institute. His team treated Craig after the heart attack.
He had stents done in a staged manner. So when I initially met him when he came to the hospital, he had a critical blockage in one of his major arteries, and we fixed that in the LAD. And he also had blockage in another major artery, which I knew would have to be addressed.
Dr. Tarani knew that Craig would have to be on antiplatelets for a period of time.
And I wanted to see what would be the best way to tailor the therapy to his individual genetics. With regard to Plavix, it's a great drug. It's not the right drug for every patient.
Plavix is what we call a prodrug, meaning that it is not active when it first enters the body. It has to undergo further metabolism to become active and inhibit platelets. This is really important in preventing future heart attacks.
Before this test came about, we would give the patient the drug and assume and hope that it was working in the patient.
Dr. Paul Goebel is the Director of Cardiovascular Research at Innova and oversees the MetaMap Plavix test. A simple swab of saliva is placed into a medical device that rapidly determines whether the patient has the right genes to metabolize Plavix.
And this is that machine?
And this is the machine, that's right.
And within an hour you know whether this is the right drug for the right patient?
This test will tell us within an hour if the patient has a mutation in the gene that would predict a poor response to the drug.
What would be the consequences if they weren't the right patient?
The one consequence could be a clot formation. Now, clot formation in stents overall is a rare event, happens in several percentage of patients, but those patients we know who carry particular mutations in their genes have a much higher risk of developing a clot in their stent than patients who don't.
The test revealed that Craig is a good patient for Plavix. He's now in cardiac rehab 3 days a week and exercises regularly. Craig is glad to be a pioneer of this test and compares that planning and ingenuity to his engineering role at NASA, which requires precise calculations to place satellites and radar systems.
And that's exactly what they're doing with this test, is to tailor the medication to the specifics of the patient, to those specific conditions.
Well, welcome back. Dr. John Deacon's back with us as well, and we've now been joined by Dr. Paul Goebel. Welcome to both of you. Glad to chat. And Dr. Goebel, we should note, you're the person who pioneered this test to see whether or not Plavix actually could work on a certain person. Is it your thought that everybody who takes Plavix should have the test first?
Absolutely. Because of the reason, as mentioned, that this is a prodrug and its ability to work is really affected by the genetics of the patient. So one size fits all is not appropriate for this drug.
Now, it's especially important because this is a drug that is really widely prescribed. I mean, if you have a heart incident, many times you will be prescribed Plavix, right?
This is the most widely used antiplatelet drug in the world, next to aspirin.
So do you think that this is something that can be expanded to look at other drugs as well? Is that already starting to happen, Doctor?
This is already in the works. The greatest body of evidence that we have right now with the drugs that we give to patients who have stents is with this drug Plavix.
And I guess it'll be also expanded to many other drugs in the future. Dr. Deacon, I'll ask you, what role do you see pharmacogenomics playing in improving patient outcomes to those who have heart disease or cancer?
You bet. There's now over 200 drugs that the FDA has said there is some genomic marker around it. So if we want to use those drugs to personalize their therapy, there is usually some testing being done. That's with cancer drugs, cardiology drugs, and other fields. As we're getting the technology down so we can return a result back in an hour, that's what's going to revolutionize the change in healthcare. Instead of waiting a month or 2 months for a test, if we get the result back in an hour, we can prescribe the right drug for that patient in their meeting with their physician.
In the future of this, very quickly, could we see a day when you're prescribing Tylenol or Advil based on whether or not somebody's genetics match up?
You bet. There actually are markers for drugs like Advil and those medications. So actually using those genomic markers to personalize therapy and everyone being tested early on in their lives is actually a way of doing that moving forward.
All right, great conversation, guys. We'll get back to you soon. But up next, pharmacogenomics is not just for adults. We're going to learn how Innova is helping new parents understand exactly the drugs their child might be able to take in their lifetime. It's called MediMap, and we'll talk about it after this.
Genomics, the power to predict, is sponsored by Innova. Join the future of health.
Let's create a body of research focused on cardiac genomics.
Let's see if you have heart disease that's invisible on a stress test or sonogram.
Let's use genomics to know if you're 1 in 5 patients who shouldn't take the most common blood thinners.
Let's use your DNA to defy a family history of heart trouble by taking proactive steps now.
Innova. Join the future of health.
Welcome back. Having a child can certainly be an exciting time, and every parent wants their kids to grow up healthy, but sometimes health issues will arise, and knowing ahead of time which drugs your child will be able to take, well, that is some powerful information. Innova is providing that information to new parents about their babies. It's called MediMap.
It was a very happy first birthday for baby Evan. She was showered with love and plenty of gifts.
She's pretty much the perfect baby.
One early gift that will last Evan a lifetime came from Innova Women's Hospital.
Less than a year after Evan was born, her parents received this in the mail. It's the results of her MediMap test.
All it took was a simple, painless swab of Evan's cheek right after delivery. But the test would yield a wealth of information about how well she'll respond to certain prescription medications. The findings come in 3 categories: green for okay, yellow for questionable, and red to avoid. Drugs flagged red are not effective, or they can cause unwanted side effects. What stood out for Evan's mom, Rachel, who is also a nurse at Children's Hospital, was the drug codeine. While no longer recommended by the FDA for children under 18, Rachel says some physicians will prescribe Tylenol with codeine to children for pain during procedures like a tonsillectomy. Based on Evan's DNA, getting any drug with codeine as an ingredient could be life-threatening.
That she has a gene that causes her to convert codeine into morphine quicker than a child who doesn't have this mutation. So that means that it's possible that she could overdose.
Another popular drug that showed up in the yellow category for Evan was warfarin. It's a blood thinner used to prevent heart attacks, strokes, and blood clots.
We don't know what her future holds, if she would ever need any kind of medication, but now we know what can and can't be prescribed for her.
And the one-time test and its results will not change as Evan gets older.
It's been extremely important.
Yes.
I didn't think I would be the kind of mom I am, just being a nurse in the healthcare field. I thought maybe I'd be a little bit more laid back and like, oh, you know, she'll be okay. But I've turned into that paranoid mom that turns into mama bear anytime anything happens. So it's good to know as much information as possible in terms of her health.
What an adorable baby. Well, Allison, let's talk very quickly about this. As you do this test on more and more babies, tell us about what you're finding.
Well, we have looked at data over 5,000 babies and growing, and we are seeing that in those red categories, they talked about the red, green, and yellow categories. When we look at babies, over 97% of the babies who have had the test do have at least one red drug, which means that that's an actionable result and would affect their dosing, and in some cases there would be a recommendation for an alternative medication altogether. And one point to emphasize here, this is not going to change as the child gets older, right? Right, so because this is genetic testing and we're looking at variants in their DNA, these results are good for life, and we would not expect them to change over the child's lifetime. So Dr. Deacon, is this a game changer for physicians as they look at people as they obviously grow up, need more medical care?
I think this is an example of where healthcare is going, where literally from day one, you're tested and found out what drugs you should receive, what diseases you might be at risk for. I think the day is not all that far in the future where everyone will be getting this kind of test to help guide their health care, their drug choice, and their physician treatment.
You know, it strikes me that if you find a certain drug is rejected by a great number of people, it gives the industry an incentive to create another drug that might be more effective.
Exactly. In the U.S., the FDA, under the FDA leadership, pharmaceutical companies and researchers have advanced this field over the last 10 years tremendously. Now it's up to clinicians and health systems to be applying that to make the dream of personalized care a reality, and that's what we're trying to do at Inova.
Make us all healthier. Well, up next, we are going to learn about a program at Inova that's looking at how the environment kids are raised in is just as important as their genes in determining their future good health. So stay with us.
Genomics, the power to predict, is sponsored by Inova. Join the future of health.
Let's just say it. There's no such thing as cancer. There's only your cancer and the precision treatment we derive from your genes.
Let's embrace the wisdom of your cancer's DNA when we learn a throat tumor is best treated by a breast cancer drug.
Let's give you a seat at the table of experts in your cancer. And as a team,
develop a treatment plan with and just for you.
Inova. Join the future of health.
For years now, scientists have been studying how the environment affects our health, which is why we know, for example, that secondhand smoke can adversely affect our lungs. Today, researchers at Inova are working along with other leading academic medical centers, studying how the environment, along with genomics, plays a role in determining a person's health over their lifetime. It's called the ECHO program.
It will revolutionize the diagnosis, prevention, and treatment of most, if not all, human diseases.
17 years ago, with the successful sequencing of the human genome, President Bill Clinton proclaimed the beginning of a new era in health and science. It was the aha moment, the silver bullet for predicting and treating diseases, or so we thought. But it turns out there's more to it than just genomics.
It's not just genomics, it's behavior, it's biology, it's chemical, and it's environment. And it's all the interactions of all of those things.
ECHO stands for Environmental Influences on Child Health Outcomes. The goal of the ECHO program is to research and understand the role the environment plays in molding a child's neurodevelopment.
We now have almost 3,500 families in this cohort, and we follow them every 6 months. So we're collecting data as these babies, now young children, grow up.
One of the first families Inova recruited, the Warrens, Emma, husband Chris, and second son Garrett. Emma had a difficult first pregnancy, and the second time around, at age 37, she was considered high risk. Making sure she stayed healthy before delivery was a priority.
You know, just being healthy overall, that was really important for me because I wanted to make sure that I gave him the best opportunity to be healthy through the pregnancy and then as an infant when he was born.
Not until she was recruited for ECHO did Emma ever consider risk from environmental exposure on the child she was carrying.
I wish that I would have known more about how the environment can impact a fetus. while you're pregnant, because I think I might have been a little more careful.
There's 270 days of that baby's growth and development that we don't get to see. While mom is pregnant, if she has an exposure to a toxin, if she has a disease, if she has a bacterial outbreak, all of those things are then absorbed and felt by the fetus.
Did you play with any friends?
Yes.
As part of the ECHO program, since he was born, researchers have regularly checked in with Garrett's parents.
What are they asking you on the questionnaire?
They asked me a lot of questions about how, like his health, how he's developing. Does he have any health problems? Has there been any behavioral trouble? Does he have any health challenges like asthma?
And does he?
He does. He was recently diagnosed with asthma.
Using information from the Warren family's genomic sequence may help explain Garrett's asthma and allergies. ECHO researchers, on the other hand, will use this information to find out if there are any influences from environmental exposure in their community, right down to the street where they live.
If you live in the same zip code, but one person lives on the corner of two busy intersections and another person lives back into the to one of our parks, it makes a difference for your air quality and your soil that the children are playing in.
There are 5 pediatric health outcomes under study in the ECHO research, with ANOVA's particular focus being brain development.
I think it's great to be a part of the cutting edge of medicine and to be able to have help in some small way to make the future better for my children's children.
I've heard it said genetics is destiny, but ECHO is telling us something a little different, Dr. Deek.
You bet. It's not just genetics, it's nature and nurture. And as part of this research effort that we're doing with Harvard University of North Carolina, Mount Sinai, we're following 3,000 families in Northern Virginia looking for those health outcomes. One of our early findings was we've looked at obesity in childhood, and at 1 year, 39% of our children were obese, and 10% were morbidly obese. We found genomic risk factors for that. We also found nurture aspects of that. We found that if kids ate French fries or drank too much juice by the time they were 1 year old, they also were at risk for obesity. So it's not just nurture and nature, it's genomics and their environment, their parenting, their environment that they're exposed to. And all of that is important as we look at improving those outcomes in the years ahead.
An important balance. Cynthia DeMarco, as you look at the genomics aspect of this, what do you hope people take away from our broadcast tonight?
I think all of these stories really emphasize how important it is for patients to be seen as part of a multidisciplinary team and to be active participants in their own health care. And that's really the kind of health care that we are promoting at ANOVA.
Dr. Cannon, almost 2 decades since the genome was mapped. Is this finally coming down to the real world as far as health care?
Well, we've seen several real life examples in this program. I think we're just scratching the surface, and I look forward to a lot more improvement in years to come.
I look forward to it too. Thank you, guys. We appreciate your time tonight.
Thank you.
Great conversation. And if you need more information about ANOVA's work on any of the programs we learned about tonight, please visit inova.org. Thank you for watching. Have a great night. Bye-bye.